at the meningitis and the CSF findings. So before we start, we'll ask some questions. That is, the first question is, in terms of the bacterial, what is the level of WBC? Second question we want to ask is, in terms of the TB, what is the protein content in the CSF? So in this video, you'll find the answers to these questions and learn in detail about this topic. So to begin with, for comparison, we need to know what is a normal value. So normal value of glucose. So this is expressed as mg per dl. And the normal value of glucose is 40 to 85. And this is, as you know, the value mg per dl. So this is in terms of glucose. And now what about protein? So in terms of protein, the value is 15 to 45. And what about WBC? The normal WBC will be WBC, and this will be less than 5. This will be less than 5, and it includes about 60 to 70%. It includes 60 to 70% of the lymphocytes, as well as the less than equal to 30%. This is of the monocytes, as well as the macrophages. So this is about the normal value of the CSF finding. So then we'll look at the bacterial. So how is the bacterial different from this? So in terms of the bacterial, the glucose level, if you see, it is less than 40. And after the glucose level, we have the protein which needs to be seen. So in terms of protein, it is greater than 100. And what about the WBC? So the WBC in terms of the bacterial, it is greater than 1000. This is the WBC. So here there is nothing but an increase. There is an increase in the PMN. And this makes it greater than 80%. So just to recap what we did in this slide. So we have discussed the normal value of the CSF. So in terms of glucose, we have the glucose finding, the protein, as well as the WBC. So these are the main aspects we are going to look at. So in terms of glucose, the measurement is done in case of mg per dl. This is for the glucose, this is for the as well as the protein. And in WBC, the measurement is done per microliter. So in terms of glucose, the normal value is 40 to 85. In terms of protein, it's 15 to 45. And WBC, it comes less than 5. And there are 60 to 70% of the lymphocytes, and less than 30% is the monocytes and the macrophages. Then we also looked at the bacterial. In terms of bacterial, the glucose is less than 40, and in the protein, if you see, it is greater than 100. And WBC is greater than 1000, an increase in the PMNs that amounts to greater than 80%. Next, we'll be looking at the viral. So what happens in viral? So in terms of viral, we need to know that the glucose, it remains normal. The glucose is normal. And what about the protein? The protein, if you see, it is 20 to 80. The protein is 20 to 80. And WBC, in terms of bacterial, it was significantly high. Here it is slightly lower, that is 25 to 500. And what does it include? It predominantly includes the lymphocytes. And after the viral, we look at the TB, the tuberculosis. So in terms of the tuberculosis, the glucose if you see, is less than 50. And this is in terms of 75% of the cases. And after looking at glucose, we have to see the protein. So what about the protein? The protein is about 100 to 200. And then what about the WBC? The WBC in this case is 25 to 100. It becomes significantly lower compared to the bacterial and the viral. And what does it predominantly include? So it includes the lymphocytes. So just to recap what we did, we saw the viral part, and in viral, the glucose, it remains normal, whereas in the protein, it becomes about the 20 to 80. And the WBC, if you see, it is about 25 to 500, which is less compared to the other counterparts. And then there is it includes predominantly it includes the lymphocytes. Then we saw the TB. In the TB, the glucose was less than 50, and this is in case of 75% of the cases. And then when we see the protein, it is about 100 to 200. So what about the WBC? WBC ranges between 25 to 100, and it has predominantly the lymphocytes. Now to move ahead, we will look at the fungal. So what happens in the fungal? So in terms of the fungal, we'll look at the glucose. In the glucose, it can be normal. It can be normal or it can be decreased. And then what about protein? The protein in case of the fungal, it is 150 to 300. This is the protein. So 150 to 300, this is the highest so far what we saw. And then when you look at the WBC, it is about 40 to 600. It is about 40 to 600. And what does it include? It includes the lymphocytes. It includes the lymphocytes or the PMNs. Lymphocytes or the PMNs. And it depends on specific organism. And it depends on the specific organism. And lastly, we are looking at the parasitic. So in terms of parasitic, the protein, the glucose, it remains normal. And what about the protein? The protein is significantly high compared to others. That is, it can range between 50 to 200. And then we also have the WBC. So WBC is per microliter, and this is very high in case of parasitic. That is, it can range out from 150 to 2000. And what does it include? It includes a significant high of the eosinophils. Significantly high eosinophils, and this amounts to greater than 50%. So just to recap what we did here, we discussed the fungal. So the glucose level, it remains normal or it can also decrease. And then we saw the parasitic. Parasitic ranges between 150 to the 300. And then what about WBC? WBC is significantly, it is higher. That is, it can go from 40 to 600 up to 600. And it includes the lymphocytes, the PMNs, and it depends on specific organisms as well. And then we moved on to the parasitic. Here, like the fungal, the glucose remains normal, and the parasitic, it is significantly higher compared to the other. So it is the protein is 50 to 200. And then looking at WBC, it ranges from 150 to 2000. This is very high, and it includes predominantly the eosinophils. Now we'll be answering our questions. So to begin with, the first question we asked was, in terms of bacterial. In terms of bacterial, comment on the WBC. So this was the question we asked. So the WBC here, it is greater than 1000. This is in terms of bacterial. And there is an increase in the PMNs. There's an increase in the PMNs, and this is greater than 80%. The next question we asked was in terms of the tuberculosis. In terms of TB, what is the protein content? So in terms of TB, the protein is nothing but it is about 100 to 200. So just to recap the answers, the bacterial, the WBC is greater than 1000, which has a significant increase in the PMNs, and then the TB, you have the protein, it is about 100 to the 200. So this was about the meningitis, the CSF findings. To learn more and grow more, please do subscribe.